There are hundreds, maybe thousands of people out there in dementia care homes who do not have dementia. With the correct diagnosis and timely treatments, these people can be taken out of the care homes or not end up in a care home in the first place and returned to normal life. In this video, I will help you to recognize the medical conditions which mimic dementia. We call them fake dementia, or in science, in medical books, you also will see the term pseudodementia. These conditions make the people to present with symptoms of dementia, but actually with the correct treatment the dementia symptoms disappear, unlike the true dementia diagnosis, which is a progressive illness, and despite our best efforts the symptoms deteriorate. Hello, I'm Dr. Elena Mucci. I'm a consultant geriatrician and a specialist in dementia care. I treat both mental and physical health problems in my patients, and I see them holistically. Hence, I'm able to recognize this fake dementia diagnosis. What are we talking about today? It's depression. Depression in older people does not present the same way as in younger people. The sadness, feeling depressed and low, sometimes it's not there at all. Also, older generation tend to be in denial of their symptoms. They have stiff upper lip. They try to think that they can just get on with it and would not admit their symptoms to their loved ones. So it takes many months, maybe even years, for the family to recognize that the things are not right. The symptoms could be dropping their usual activities, hobbies, stopping going out, stopping enjoying their food, start losing weight, stop having a proper nice sleep, becoming extremely tired. Eventually, if untreated, depressive symptoms start having effect on cognitive abilities of the individual. Without a very thorough history taken, it is not unusual to mix these diagnoses and misdiagnose people with depression with dementia. Of course, dementia and depression go hand in hand, and patients with depression have a high risk of developing dementia, and patients with dementia tend to develop depression. However, many people have depression without dementia, and treating the depression can lead to the disappearance of all the symptoms which were taken for dementia. I'm now going to talk to you about David. David's family asked me to see him in his dementia care home. He had been there for about 2 years after he completely lost self-caring skills, developed severe short-term memory loss, and despite the best treatments, nothing worked, and the family had no choice but to put him into a home. By the time I saw him, he was already severely overloaded with multiple antipsychotic medications, dementia medications, sleep medications, and the state I found him was very, very sad. David is a 78-year-old man. At the time of my visit, he was very drowsy, hardly could talk, was smacking his lips continuously, which is one of the side effects of antipsychotic medications, or can be side effect. I became very suspicious about David, that the primary diagnosis here is depression rather than dementia, although dementia could be the underlying diagnosis too. I gradually took David off all his antipsychotic medications and sleeping tablets. He slowly, over the course of many months, came to life. I then established him on completely different antidepressants. Apart from antidepressants, David is also having cognitive behavioral therapy and seeing a physiotherapist on a regular basis. 6 months after our relationship with David and treating his depression, most of his symptoms disappeared. He is now eating and drinking well, enjoying the company of his family, and started going out on a regular basis. We had been able to take David out of the dementia care facility, and now he is living in a residential care facility where he has a degree of independence and started looking after himself. The next step is getting David back to his wife and to his family, back to his own home, and I have no doubt we will succeed in that too. Dear listener, have you been feeling low recently? Have you been feeling sad? Maybe you dropped many activities you used to enjoy in the past, stopped going out. Maybe your memory is not as sharp as it used to be. Or it is possible you might have a loved one out there who is feeling this way. See your healthcare professional as soon as possible, because if you do have depression, it is a treatable condition. You can feel so much better. And if there is a diagnosis of dementia out there, it coexists with depression in so many people, and treating their depression can make the symptoms of dementia better and improve the quality of life of your loved one. There are many other conditions out there which can mimic dementia, and I will be covering those in my next few videos. Please stay tuned on my channel, subscribe today, and I will see you soon. Thank you very much.